Hi, here's another question. Here's one from Gloria Weintrub. I know a Gloria Weintrub, and I'm wondering if it's the same one. It says, do you feel that a partial tear can be treated with stem cell and PRP therapy instead of surgery? And if so, can these dogs return to full function? Also, in the case of performance dogs in general, in your opinion, is it more often structure or the activity that the dog is engaged in that predisposes to a CCL injury? So that's a two-parter. So first of all, on the stem cell and PRP therapy, I can't, yes, those can be treated. As for returning to full function, I can't answer that because I don't have as many clients in my area who are willing to do the stem cell and PRP together. And I assume we're talking about a partial tear. I do know that in Maryland at VOSM that they have been doing some research work looking at combining stem cells with PRP in order to fix partial tears, and from my understanding is the initial reports that they're getting some pretty phenomenal results. Now, the problem is returning to full function. I like to think of full function as something that lasts for several years, and it takes a while to get reconditioned to go back to that, so I can't answer that because I don't know what their results are, and I'm not sure if those dogs are able to go back to full function, and if they're okay for a short period of time and then they have a problem again. Or whether they continue to get out long term for several years and do well. So I can't answer that, but I certainly would like to try it. I mean, if my dog did that, that would be, if it was a partial tear, that would be what I would do, is I would try to encourage my surgeon to do an arthroscopic surgery to clean up the joint first, visualize what's going on, and then do PRP and stem cells in that area. So part two, in the case of performance dogs in general, is it structure or activity that predisposes to a CCL? The answer to that would be yes. It depends on the dog. It's probably structure, it's probably activity, but it's not only just structure. I also want to put in there postural issues as well. That posture is different than conformation. Conformation is what you're born with, and you can't change that. That's your bone structure, that's your muscle length, etc., etc. Posture is how you choose to stand on that. So if you have crookednesses, if there was some World Canine Wrestling Federation that was going on at home and someone got a little bit of a pulled muscle and the iliopsoas was a little tight on one side and you start to walk with one side a little more contracted and one side a little more lengthened, then that's going to change how the straightness and the balance of the movement, and that could tend to obviously make an animal predisposed to a CCL, especially if they're having some degenerative issues with a CCL. I really think the issue with CCLs is that besides the tibial angle, that is the reason why we have the TPLO and the TTA, is I think we need to be looking as to why these CCLs, all of a sudden we're having this epidemic of these CCLs actually rupturing, and they're associating it with dogs being some kind of chronic autoimmune or immune-mediated problem. And, you know, there's been some interesting research by Dr. Glickman at Purdue where he found that vaccinations with the typical approach that we have, that one of the things they did find is they did find some of these dogs had some increased autoantibodies to connective tissue and collagen. And that could maybe be an issue. You know, a lot of these vaccines do have things in them called like squalene. We don't know what these adjuvants are because they're proprietary, but if you keep getting exposed to it all the time, how could your body not make an immune reaction to it that we may potentially have some cross reactions? So I think that instead of focusing in on doing all the surgeries, I would really like to see somebody start looking at why we're having so many, why it seems like we have an epidemic of so many CCL deficiencies. Obviously, I mean, Dr. Chris Zink has found some interesting links with early spay-neuter, and that's been a new thing, and a lot of dogs are rescues, and a lot of the rescues feel like they need to get these animals spayed and neutered at 3 months of age, and I think that's a big mistake, especially in a dog that's going to be a performance dog. So those are my answers, Gloria. I hope that answered it. It's not a simple answer, and the answer to whether structure or activity is yes.